If you weren't built for the cold, Abercrombie's kickoff to spring sale is just for you. I seriously cannot wait for rooftop season because that means I get to start wearing my A&F Mila dress all the time. She has pockets, and that makes her a favorite in my book. And speaking of favorites, Abercrombie's best-selling Scarlet Scored is part of the sale too. Stack an extra 15% off with code SPRINGAF now through March 3rd. Offers valid in the US and Canada. Exclusions apply. See details online.
Hey guys, have you heard of Goldbelly? It's this amazing site where they ship the most iconic famous foods from restaurants across the country, anywhere, nationwide. I've never found a more perfect gift than food. They ship Chicago deep dish pizza, New York bagels, Maine lobster rolls, and even Ina Garten's famous cakes. So if you're looking for a gift for the food lover in your life, head to goldbelly.com and get 20% off your first order with promo code GIFT.
This is the Daily Blast from the New Republic, produced and presented by the DSR Network. I'm your host, Greg Sargent. In West Texas, an unvaccinated school-age child just died of measles. This is the first reported death that's related to the frightening recent outbreak of the disease, which has been spreading in Texas and now into New Mexico. All this came up at President Trump's cabinet meeting on Wednesday afternoon. What happened was really troubling. Elon Musk, apparently a de facto member of the cabinet, cavalierly admitted that his cuts had briefly closed down Ebola prevention. Health and Human Services Secretary Robert F. Kennedy Jr. said that these types of measles outbreaks are not unusual, something critics immediately jumped on. Today we're talking to Stephanie Saki, a former senior HHS and White House official under President Biden who specializes in pandemic response. We're going to get into how serious this measles outbreak has become and how big a threat having people like Musk and RFK overseeing public health really is. Thanks for coming on, Stephanie.
Thanks for having me, Greg.
Let's start with the comic relief, or, well, maybe this isn't really that funny. Here's Elon Musk, who's somehow got invited to a cabinet meeting talking about Doge.
And I should say, we will make mistakes. We won't be perfect. But when we make a mistake, we'll fix it very quickly. So, for example, with USAID, one of the things we accidentally canceled very briefly was Ebola, Ebola prevention. I think we all want Ebola prevention. So we restored the Ebola prevention immediately, and there was no interruption.
Stephanie, you'd think that this would give these guys pause, that it would be an occasion to ask themselves whether it's a bad idea to have Musk's team rummaging through governmental data and crucial programs. Your thoughts?
Well, I'm guessing that's probably not the example they would have preferred for him to have given in that moment. It seemed a bit off the cuff. I hope it does give us pause. I hope it gives Americans pause. I think Ebola is something that is pretty salient for Americans. And when they hear about something like, flipping a switch of turning off Ebola prevention, which I think is a very simplified way of describing it, they should be concerned. Particularly when there are ongoing Ebola and Marburg and unknown outbreaks happening in multiple countries right now.
Well, and we have a measles outbreak in the United States. This poor kid was unvaccinated. Many of the cases of measles that we're now seeing are in other unvaccinated kids. Can you talk a little bit about what we know about the outbreak at this point?
One, I should say that as a parent of two young children, there are many children who are not vaccinated or not fully vaccinated against measles, not because their parents don't intend to get them vaccinated, but because you're not fully vaccinated until your age is 4 to 6. So children usually get their first dose around the age of 1 and their second dose of the measles vaccine around the ages of 4 to 6. So that's when they're fully vaccinated, which means that children who are not fully vaccinated can also be at risk, even if their parents want to protect them with vaccination. That said, I think in this case, the outbreak originated, as I understand it, from what CDC has shared in a community that is under-vaccinated, including children who are old enough to be vaccinated. It's not particularly surprising. Measles is the most infectious disease that we know about in the world, that exists in the world. So it takes advantage of cracks in the system. I think in the public health community, we think about measles as the canary in the coal mine. When you have breakdowns in your public health system, one of the first things you'll see is measles outbreaks because it's just so contagious.
Yes, and I think we're seeing a lot of alarm among public health professionals on social media and so forth. And it's being kind of exacerbated by the kind of wanton and indiscriminate hacking away at government that Musk is doing right now. People are getting laid off all over the place in places like CDC, the NIH. Medical researchers are getting pushed out. Putting it all together, it seems like there's absolutely no serious concern on the part of the very highest people in our government right now about what you're saying, which is that this measles outbreak is signaling a problem with our public health apparatus. Is there any indication that you see that they're taking that idea seriously?
Yeah, I think one of the challenges having been in the White House is that when you avert a crisis, you get no credit for averting a crisis. And so Americans often are not fully aware of the many crises that are being averted, not just by the federal government, but actually more often by state and local governments. And so I think what we're starting to see in different spaces, and these measles outbreaks, there were, of course, measles outbreaks in the past, but the way that they're being handled, the scope of the outbreak are a symptom of some of our systems starting to break down. Those systems include trust in vaccination. And we've seen a decline in trust among Americans toward vaccination in the last few years, especially in the wake of the COVID pandemic. So this didn't just happen a month ago. It's been happening over time. What you start to see are some of these outbreaks.
Well, as it turns out, the people who have done the most to undermine trust in our public health system are now running it. The kid who died of measles came up at Trump's cabinet meeting. A reporter asked Trump about it, and then Trump turned to RFK Jr. to get him to answer. Listen to this.
Bobby, you want to speak on that?
We are following the measles epidemic every day. I think there's 124 people who have contracted measles at this point in Thames County, Texas. Mainly, we're told in the Mennonite community. There are 2 people who have died, but we're watching it, and there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Stephanie, there's a lot to unpack there. First, is it true that this is not unusual?
Well, I think it's true that there were measles outbreaks last year and the year before, although if you look at the numbers even from 2024, they were much higher than 2023. So we're going in the wrong direction. We should also keep in mind that we're now about 2 months into the calendar year. So we shouldn't be comparing what has happened already in 2025 to what happened throughout the entire year in 2024. So yes, it happens. I think we should be very concerned that I think we're about a third of the way in 2025 toward the numbers that we got to in 2024. We think of measles as the canary in the coal mine because it is the most contagious disease. There is also a very, very effective vaccine against measles, and it is very dangerous for children who are unvaccinated. So any death in a child is a massive failure of the public health system. That is a collective failure. I'm not saying it's RFK Jr.'s failure, but it is a failure of the public health system. That is a failure of leadership. There should not be a child dying of measles in the United States or frankly anywhere in the world because we have such an effective vaccine and we know how dangerous it is. So I think to cast that aside as, technically it's true that there have been measles outbreaks in the past and there will be measles outbreaks. It's a major problem for our public health system, and it is very much the responsibility of the Secretary of HHS to get this outbreak under control, but also to make sure that we don't see additional outbreaks and certainly that we don't see additional deaths in children.
Should he be saying it's not unusual?
I mean, I think there are a lot of things that RFK Jr. has said that I would not say and would not recommend for a secretary of HHS. So I don't know that he's taking advice from me on that. I think he should be very concerned. And I think he should be telling his team that they should be on the ground working with CDC in Texas and New Mexico and in other states, getting this under control and surging any support they need immediately. And frankly, I think both he and President Trump should be expressing empathy and regret for what is happening because a child died of something that is preventable.
Speaking of Trump, I wanted to bring this up as well. I want to point out that Trump himself didn't really speak at any length about this. Looking at this from the perspective of public health, shouldn't a president want to go out of his way to personally reassure the nation at a time like this, tell people what's being done, tell people the government is on top of everything and understands the threat? As you said, RFK should be saying really vociferously, we're surging resources, we're doing this, we're doing that, we're doing the other thing. He basically said we're just monitoring it, it's not unusual. Although he kind of said they're taking it seriously. And here Trump doesn't even use his own bully pulpit to address it. We know Trump doesn't take pandemics and disease seriously. Are we already seeing that here?
Yeah, look, I mean, I think if you look at how the meeting started, it started with Elon Musk speaking at the top about Doge and the cuts that are being made across the government. That clearly is the headline that they are looking to have coming out of the meeting. And that's what President Trump seems to be very focused on. The challenge is that there are downsides. There are reasons that these services were in place. And when you start to cut them and remove them, you are increasingly going to see crises that happen, emerge, are exacerbated because of those cuts. So it seems to me that President Trump is very interested in talking about making cuts, saving money in the budget without talking about the consequences of those cuts. And he's passing the baton over to his cabinet, who is going to be having to deal with the cuts that have been made in terms of crises emerging and the inability to effectively respond to those crises.
And don't we want a president at a time like this to use his presidential authority to tell the American people that things are being done, that the threat is taken seriously by them? Shouldn't he want to do that?
Look, I think part of being a leader is saying things that, maybe your supporters don't want to hear in the moment because it's the right thing to say. So what I would have loved to have heard from him and from RFK Jr. is to say, we have a safe and effective measles vaccine. Measles is very dangerous to children, and you should talk to your pediatrician about your comfort level with getting this vaccine. But I recommend it, and I got my own children vaccinated, which I imagine he did. I would love to have heard that from him or from RFK Jr. or from CDC to come out and say that at the leadership level. That's what leaders should do to protect the American people.
It's February, and that means Valentine's Day is around the corner, love is in the air, and the new Trump administration is causing stress with every new action. The best way to stay up to date on the latest news and breaking headlines during this turbulent time is to become a DSR member and gain access to additional content across our network, in addition to other exclusive benefits like an ad-free listening experience, exclusive content, access to our Discord community, and more. Use code DSR2025 to get 40% off of your membership and sign up today at thedsrnetwork.com/buy. That's DSR2025 at thedsrnetwork.com/buy. Thank you and enjoy the show.
That is such an important point. RFK didn't urge people to vaccinate. We should remember, by the way, that RFK has written that, quote, measles outbreaks have been fabricated to create fear, close quote, which has caused government officials to, quote, inflict unnecessary and risky vaccines on millions of children for the sole purpose of fattening industry profits. So there you have it. He didn't tell people to vaccinate. He didn't tell people that the government is surging resources. He didn't reassure people in any significant way. Neither did Trump. I think that's highly alarming, no?
Absolutely. And I mean, I think that as a parent, there's no way that the parents in these communities were anticipating this outcome. The parents of that child did not think that the child was going to die. Parents are trying to make the best possible decisions they can make for their own children, and they are looking to leadership to, in their communities, maybe not in Washington, but in their communities, to give them guidance on what's best for their children. I think it is terrifying that we have political leadership in Washington that is not willing to just stand up and tell the truth to the American people, even in such an acute situation where children's lives are at risk. What does it mean in terms of what's happening when something is less visible and less obvious to the American people? How do we know that we're being told the truth? How do we know that they're making decisions, even tough decisions, to protect us now and to protect us in the future?
It sure seems clear to me that you're absolutely right. I want to go back to something you said earlier. I haven't been monitoring this. Maybe you have. The CDC, have they been saying the sorts of things that we would ordinarily want in this situation?
So I think CDC, just looking briefly at their website earlier today, they have updated, I believe, information about these outbreaks, the latest on the outbreaks that have happened historically. I don't think that they had something on their measles page about the child death, but usually they defer to the state and to the family to announce that information when it happens. So it does seem that CDC is including up-to-date information on their website. What I would like to see is for the CDC director to be out there and talking about the safety of measles vaccines and calling on Americans to vaccinate their children against measles.
So if you step back, here's what you've got. You've got Elon Musk, who's basically now a cabinet member, apparently, rampaging his way through the government, downsizing all sorts of different levels of government that are focused on public health in various ways and medical research and biological research. You've got him, quote unquote, putting USAID through the wood chipper and calling it all kinds of vicious names. He called it evil and a criminal organization and said time for it to die. USAID isn't exactly a public health organization in the United States, but it does a lot for health abroad. You've got Elon Musk saying, oops, I accidentally turned off Ebola prevention. You've got RFK Jr., who has spread anti-vax lunacy about measles in particular, downplaying the measles outbreak that we're having now. You've got Donald Trump not using his bully pulpit to say what he should be saying about it. These are not people who think the state should be involved seriously in protecting public health. Right? Isn't that the big story?
Yeah. I mean, also, President Trump was elected by the American people. So I think the question is this what people were anticipating when they elected him? And is this what they expect and want from him and his administration? We're very early on. So, what worries me is the sort of mini crises that we're seeing right now. And the measles outbreak is a crisis, but it's not an unexpected crisis. There will be unexpected crises. And what worries me is what we are not doing right now to prepare for and anticipate those unexpected, much more difficult crises and how they will be able to respond and handle those. It's easy in the first month or so, or the first couple of months, to make a bunch of campaign promises that you're saying you're delivering on by making cuts. But it is very, very difficult when you are sitting in the White House to keep the American people safe every single day in ways that are not visible to the American people. And I worry about how effectively they are going to do that for the next 4 years.
Can I ask, do you expect something like the COVID pandemic to come back, or maybe even something worse? And how do you think the response will be? I think there's reason to believe it could be actually worse this time, right? What are you anticipating? What's the worst case scenario here?
Oh boy, probably the worst case scenario is something none of us could even anticipate as it has been in the past. But obviously, we're all paying close attention to bird flu, which has been evolving pretty rapidly in the United States. I think the concern is that we're one or two mutations away from that turning into a pandemic where you see human to human transmission. And the more it spreads between cows, the more cases that we see in humans, even though it has not yet spread between humans, the more likely it is that we will see that mutation happen. And that potentially could be much worse than the COVID pandemic was for a number of reasons. One of them being, back to the distrust that we're seeing in communities around the United States that was not there before COVID, at least not at the same level. But also because, many people have said that COVID could have been worse in terms of the health outcomes. It could have had a higher mortality rate. It could have spread even more easily. It could have mutated more quickly. It's not the worst case scenario. So we could find ourselves in a bird flu pandemic. We could find ourselves in, a deliberate attack from one of our adversaries because the United States looks weaker right now. I think there are a lot of risks, and that's just in the kind of biological risk space. There are many other risks too that are constantly threatening the United States and the American people. And most of the time, we are all able to live our lives and not worry about those threats because we feel confident that we have leadership in place that is tracking those threats, taking them seriously, and taking action. I do not feel confident about that right now. Having been in the White House a couple of months ago and paying close attention to those threats, I'm very worried that, best case scenario, this is a distraction and they're not able to focus on the most serious threats. And worst case scenario, they're just ignoring some of the most serious threats and focusing on things like firing staff who have been loyal civil servants for decades.
And if we do see something like the COVID pandemic, that level of seriousness, or maybe something worse, do you expect our response to be worse this time than last time?
Well, I think to try to be a bit optimistic, I think the good news is that there are people in the Trump administration and in the Trump orbit who were there for the first year of the COVID pandemic. They lived through it. There are lessons learned from that. I think Operation Warp Speed was actually a success in a lot of ways that helped keep Americans safe. So they could make a decision to learn lessons from COVID, not repeat that, do things better. I think that's a possible path to take. Another path to take is to, delay recognition of a threat. They've already, cut staff and cut funding, which puts you on your back foot to begin with. And, even to suggest that we don't need to take mitigation measures because we're just going to live our lives through a pandemic. So I think that if we had an even worse situation with a worse threat or a worse response, we could have many more millions of Americans dying. We could have a pandemic that lasts longer. We were very lucky that we had a vaccine in a year. We could find ourselves in a situation where we're waiting multiple years for vaccines or effective treatments. It could be much worse. And the way to prevent that situation is to prepare right now and make investments right now to keep staff in place who know how to anticipate and prepare for those threats, and to work with Congress to make sure that we are making the investments that we need if that kind of threat occurs.
At risk of getting out of step with the serious tone you've struck here, I'm going to take a flyer and say that having two guys play around with the government like a pair of toddlers knocking over towers of blocks is not what you had in mind when you say that the state should be getting prepared.
It is not. It is not. I will say that there are people inside the government, at lower levels who have a lot of expertise and would like to take these actions, and hopefully they will be empowered to do that. So there are people there who can do it, and there are certainly civil servants who can do it. But if you get rid of all of them, then you lose that capacity.
Right. We will just say now, all of you out there in the government who really want to do the right thing, best of luck to you. We really need you to do that. Stephanie Saki, thank you so much for coming on with us today.
Thanks very much.
You've been listening to The Daily Blast with me, your host, Greg Sargent. The Daily Blast is a New Republic podcast and is produced by Riley Fessler and the DSR Network.